I know. Hi, I'm Sarah Stewart. I'm a family nurse practitioner. I am certified in obesity medicine and I specialize in weight management. So a couple months ago in April, I had some labs checked. I had my fasting insulin level done, my fasting glucose, and also my hemoglobin A1C. I was kind of shocked to find out that my A1C was 5.6, my insulin level was 7, and my fasting glucose was 115. I really had no indication or reason to suspect insulin resistance. I try to practice what I preach. I eat whole foods. I don't really consume added sugars on the rare occasion. I eat within an 8-hour period and fast for 16. So when these labs came back, I kept thinking, was it my level of physical activity? Maybe I was snacking more in my first year of practice, a bit more sedentary, sitting behind the computer and charting. And I actually, while reading this book by Dr. Peter Attia called Outlive, The Science and Art of Longevity, it was actually explained pretty clearly as to why somebody with like a normal BMI would be more at risk actually. So fat storage capacity varies widely among individuals. Some people have subcutaneous fat storage capacity equivalent to a regular bathtub, while others may be close to a full-size jacuzzi or a hot tub, and then some may have, the fat storage capacity of a 5-gallon bucket. So subcutaneous is stuff right under the skin. It's the fat we can pinch. It's associated with longevity. It's protective. It regulates our body temp. The visceral is the deep intra-abdominal fat. It's dangerous because it can infiltrate all the vital organs, including liver, heart, kidneys, pancreas, drive fatty liver disease and insulin resistance. So for somebody who has a very low visceral number, which I know, I've used a BIA scale at home, which I've been told that it's very accurate to some of the more expensive ones that are used in medical offices. Visceral number's low, which means I don't have fatty liver disease, but my subcutaneous storage is low because of my body type. And what does that mean? It just means that I'm not able to move excess energy in and out of storage like somebody could with a higher percentage of subcutaneous. So I have less metabolic leeway when compared to somebody who has like a higher percentage of subcutaneous. So someone who carries a bit more of the subcutaneous tissue may also have greater storage capacity and thus more metabolic leeway than someone who appears to be more lean. So this is why we can have someone that is of normal weight who is metabolically unhealthy and someone who is carrying excess weight and meets criteria for obesity who is technically metabolically healthy because they have a low visceral, they don't carry any associated conditions like hyperlipidemia or fatty liver, diabetes or hypertension. So this is a really great explanation as to why or how I kind of ended up in this situation. So what am I doing about it? I have set myself very clear guidelines on physical activity, so measurable and specific, 60 minutes of leg exercises, working on insulin resistance in the skeletal muscle and the largest muscle group, 60 minutes per week of high intensity interval training, and 30 to 45 minutes of Pilates or HIIT Pilates, which I really enjoy. I'll know every week if I meet that goal because it's very specific, it's measurable, and I've put it out there. So the last couple weeks I've been very diligent in making sure that I meet that level of physical activity, especially with a very sedentary job. And I'm also using a continuous glucometer, which I've loved. First week that I had the device, I noticed that I was experiencing the Simoji effect, which means very low glucose in the middle of the night. It was alarming me, waking me up at midnight. My blood sugar was in the 50s and low 60s. And then in the morning, it was met with a high fasting glucose. So 120s, 130s. That seems to have resolved. I can't really explain how or why or what's different. I haven't changed my eating patterns at all or what I'm eating, but I have definitely increased my level of physical activity over the last couple weeks. So that's good. I don't like waking up in the middle of the night to an alarm that my blood sugar is dropping. And this last week, it's just been high. You know, even fasting, my glucose has been trending around 110s, 120s. Again, under a higher amount of stress at work. And some scientific questions that I've posed, you know, while I go through this is, somebody with a lower percentage of subcutaneous is fasting, because I'm also doing 24-hour fast 1 to 2 days per week. I did 2 last week. Is fasting realistic for somebody with a lower percentage of subcutaneous, or does that increase the stress response and level of cortisol to keep someone in a degree of homeostasis, if that makes sense? So am I stressing my body out too much by doing 24-hour fasts? Is it increasing my level of cortisol, which we know increases glucose levels? Is this a realistic approach? Or it's possible that just based on my hormonal fluctuations during the month as a woman, it's possible that this week is just a week where my glucose is normally high, and it's okay, and that's fine. So it'll be interesting, you know, the more that I continue with my CGM, I have a Freestyle Libre, it'll be interesting to see what I gather. So if you have any questions, feel free to reach out. Take care of yourself.